Hi, I'm Anthony Ghosh, a consultant spinal neurosurgeon and founder of the Spine MDT. And in this video, we're going to discuss some of the myths around bending and the perceived dangers it does for your spine, and the so-called safe ways to bend versus the dangerous ways to bend and lift things. I'm also going to show you evidence that backs this up, as well as expert deadlifters, how they do a proper deadlift. Now, here's a common picture we see on manual handling courses at work. Supposedly, this is an incorrect way to bend, where your back is rounded, you're bending from the hips and the back, and this is supposedly the correct way to lift something up. Bum right down to the ground, back completely straight, and lift straight up. And you may have seen numerous pictures and videos on social media on the correct deadlift, teaching you that this stance here, again, with the legs relatively straight, a bit of a bend at the knees, back rounded, is completely bad for you. And this backward curvature here, bum sticking out, is the correct way. Well, Eddie Hall, the beast, who I think he held the world record for the deadlift, half a ton, 500 kilograms, describes that method as
like a cat taking a shit.
And there is no better expert, in my opinion, than Eddie Hall on how to do the perfect deadlift. And I'll leave a link to that video below if you want to watch that for more information on how to actually achieve the perfect deadlift. And it's not just deadlifting or Eddie Hall. If we look at people in Southeast Asia working in paddy fields, just watch how they bend. They do this. They've been doing it this way for centuries. The way they bend to pick rice and crops up, slight bend at the knee. Most of the bending happens at the hip because that's where the hinge is, and the back is just nice and relaxed in doing so. But this, one could argue this is when you're not lifting a lot of weight. But one of the reasons they probably do this is that this is just a more efficient, less energy consuming way of bending to lift something. You're driving mostly from the hamstrings and the hips rather than from the back muscles or from the quads. So what if we're lifting a lot of weight? Well, let's go back to Eddie Hall here. This is the same video at the very start of his lift. He's got a bit of a curve in the upper back. He's slightly slouched forward, and it probably does flatten out a little bit in the lumbar spine. And the point he's trying to make is that he's driving from the hamstrings, and it's a hinge movement. He's focusing on shifting the hips forward, and then the barbell just comes along for the ride. But he does actually maintain a slightly rounded upper back here, and this is like the world champion deadlifter, 500 kilograms. Well, let's look at some published evidence now. This is a paper under Peter O'Sullivan's team, who I recently interviewed on my channel, and he's debunked a lot of myths about back pain, about posture, and all that kind of nonsense, that you have to be upright with your back straight and all that. So this is looked at different postures with bending and lifting. And overall, with the subjects he used, he found far more efficiency in the lift with a slightly rounded back. Now, this wasn't heavy weight, but certainly far more efficiency with a slightly rounded back. And remember, if you're lifting, a heavy weight, efficiency is what you need. Otherwise, the leg muscles fatigue. And here's a study done by Stuart McGill's team, who's quite a world-famous kinesiologist in Canada. He published a book called The Back Mechanic. I also interviewed him on my channel, so he's world-famous when it comes to back pain management. A lot of his research is actual biomechanical, laboratory-based research on different forces and how they affect the discs and the spine. And overall, with bending and lifts, and he works with Olympic lifters in improving their technique, especially if they suffered with back pain. He found that if you do lift with a very rounded back, at the extremes of it being rounded, i.e. in that very forward flexed position, you do put a lot more shearing forces on the lining of the discs and more likely to tear at that point. So he felt that a slightly more efficient lift is with the back a little bit more straight rather than rounded, but not extended backwards with your bum sticking out so much. So where I would say McGill, O'Sullivan and Eddie Hall are all in agreement is that the weight, now this is whether you're manual handling at work, lifting a box up or a barbell, the weight has to be as close as possible to the body. Eddie Hall here, has his shins touching the bar, so the bar's midway across the foot, not near the toes. So that's where they're all in agreement. Overall, if you look at Eddie Hall here, I suspect the lumbar spine here is relatively straight, and he's not overly focusing on that, but he does focus on upper back muscles being strong at the start of the lift. So whilst he starts rounded off, as he comes up, this does start to straighten, but he certainly doesn't have his bum poking out with this line here poking inwards. And all three would be in agreement that that's not a good thing. Where there's some controversies, the rounded back, the forward rounded back, versus a completely straight back. If you're just lifting lighter weights, and there's a lot of this work has been done by O'Sullivan, repetitive lifts, when you're just bending down to pick something light up, you don't have to overly tense your core muscles and tense everything up. It's just let it, in a very relaxed fashion, bend at the hips, not the waist, the hips. That's the easiest way to bend. It's really efficient, and it's less likely to cause back pain. So a lot of the work that O'Sullivan has done, and what I try and include in my practice, is trying to debunk some of these myths about how we lift things, about our posture and all that kind of stuff, the patient education, and it really helps people with back pain. And a lot of his research have shown that debunking a lot of these myths and correcting these abnormal beliefs does have a massive role to play in improving back pain, and that's what cognitive functional therapy is all about. With regards to lifts and all that, have a look at the video link below to Eddie Hall's perfect deadlift. But obviously use a personal trainer. There's some really good guys out there that I've worked with who will advise you far better than I can. If you found the video helpful, please subscribe to the channel. It really helps people living with back pain and spine disease find information that I try and post on this channel every week. Please visit us at spinemdt.com, where you can take our spine assessment tool. Thank you for watching.